if everything doesn't go right, the pregnancy gets terminated. By nature, the body will terminate that pregnancy. That is why in the first trimester, as much as 25% of pregnancies can be lost. So the fact that you are pregnant, you rejoice, but whether you will end up having a baby is only determined after you have crossed the first trimester, because there are a lot of things that can happen. All right? But we pray that all those who are pregnant, all of you that are pregnant and your first trimester, you will cross to second trimester and then you go on and have your babies. All right? But that is the first 3 months where a lot happens. It's one of the most critical period of pregnancy. And that is why that first 3 months are guided. You don't take any medication. If you must take, you must ask your doctor, because any medication you take can either make or make that pregnancy. All right? And for those who we already know have 1 or 2 issues, is the period where they have to be more critically, they have to be careful, observe more bed rest, and all of those things, just to ensure that they navigate that period. All right? And then, what does the mother feel? Like I said before, all of the early morning symptoms: nausea, vomiting, tiredness, breast tenderness, all of those early morning symptoms you feel. And all of that are all as a result of the hormone called HCG. That's the pregnancy hormone. That is what causes all of those symptoms. And the more babies you are carrying, the higher or the more you will manifest those symptoms. All right? Then the second trimester is 13 to 27 weeks. So this is where the baby grows bigger and stronger. This is when the mother begins to feel the baby's movement. In the first trimester, some women can actually not be noticed to be pregnant, particularly if they didn't have any early morning symptoms, all those pregnancy symptoms. But because your tummy is not showing, it's not growing, it's not big. When the baby is inside, the baby is growing. It's after 12 weeks that the uterus actually comes outside your pelvis into the abdomen. So a woman that is less than 12 weeks, when you palpate her tummy, you won't feel anything, because the uterus of a woman is inside her pelvis, pre-pregnancy state, not in her abdomen, It is when she gets pregnant, that first 3 months, the uterus is still there, is growing. By the 13th week, it now begins to come outside the pelvis. By the 14th, 15th week, when you press just below the navel, you'll be able to feel something hard. By 16, 18 weeks, you can now begin to feel. And that is when you also begin to feel the movement of the baby. And that movement is also subjective. Women who have the experience can feel baby much earlier than women without experience. If it's your first time, you can even get to 20 weeks, you will not feel anything. When the first feeling you will feel is a baby's kick, not even movement. Because that one you cannot miss it. You just, what happened? Your baby has kicked you. All right? Then I say, okay, I was feeling this before. That was your baby moving. All right? So in this second trimester, your baby begins to feel movement. Your energy improves, particularly for women who had severe pregnancy symptoms, early pregnancy symptoms, that had either emesis gravidarum or hyperemesis gravidarum. Some women in the first trimester, they don't eat. Anything they eat comes out. They have severe hyperemesis gravidarum, vomiting, severe nausea. They feel so weak, so tired, always want to be in the bed. All of those are all due to hormones. Once they cross into the second trimester, energy from nowhere just comes up. My God. They now begin to feel themselves. Some of them, their appetite will increase. They start looking, the things they did not eat in the last 3 months, they will eat times two of it. Energy will just come, appetite will just increase. And the abdomen becomes what? More visible. Like I said before, this trimester is the cruising trimester, where you just feel okay, nothing is wrong, everything is just going well. All right? Then the third trimester is from the 28 to 40 weeks. And this is where the baby grows, the baby gains weight a lot. And the organs, they begin to mature. Actually, the baby's rate of weight gain is so rapid in the third trimester. By the time a woman gets to 28 weeks, do you know what the baby's weight is? It's 1 kg. From 0 to 28 weeks, baby will only weigh 1 kg. At 28 weeks, baby is weighing 1 kg. From 28 to 40, baby gains more than 2 kg. Because some baby that was 1 kg at 28 weeks, by the time that baby is born at 38 weeks, baby is weighing 3 point something. That is, baby gains at least so much weight in that last trimester. All right? So, a woman's tummy that was not so big before, once she gets into this third trimester, she begins to add weight. Her tummy becomes bigger. Why? Because the baby is gaining weight, and she too also by extension will be gaining weight. And that is where she now begins to feel pains, backache. To get up from chair will become more difficult. To sleep become more difficult. Why? Because she cannot get a comfortable position to sleep. Why? Because of the weight. And then because of the weight, the baby is pressing on her bladder, so she passes urine more frequently. So you notice that frequency of urine happens early in pregnancy and towards the late pregnancy. Early in pregnancy because You can just tell her something now. That's why husbands, they have to be very careful. If you are relating with a pregnant woman, you have to be very careful because you never can tell what can trip her off. But some men have wondered whether it is the same wife during pregnancy because this is not the way my wife used to behave before. What happened? You understand? Uh-huh. Because why? It is because of the hormonal changes. The hormones of pregnancy is what is causing those changes. Mood swings. This moment she's happy, the next moment she's sad, even the next moment she's even crying. What did I say? Wait. Is it what I said now that's making you to cry? What did I say? No, it's not what you said. It is what you said plus hormone that's causing it. All right? And then your appetite, your sleeping, all of those things are things that can change once a woman is pregnant. And then physical changes, your weight. Women, they gain weight. The normal weight gain for a woman that is pregnant during the course of pregnancy is between 12.5 to 15 kg of weight. They relax. Some people already say, oh my God, you mean I will gain 15 kg? Oh my God, what will happen to me? Nothing will happen to you. When a woman is pregnant, you must gain weight. You know why? What about the weight of the baby? Where will it go to? The weight of the placenta, where will it go to? Your breast changes, where will it go to? The blood volume that increases, where will it go to? All those legs that get swollen, all the fluid, where will it go to? All those are the things that contribute to what? To the weight gain. But the good news is that once you've delivered, within 6 weeks to 3 months, all of those things begin to come back to size. Uterus that was this big to carry baby. In fact, once you deliver, that thing just reduces. And within the next 6 weeks to 3 months, it gets back to your pre-pregnancy state. That is how God has done it. And all the other things too just begins to come back to normal. All right? So weight gain, skin changes, breast enlargement, these are all physical changes that can occur once a woman is pregnant. All right? And they're all perfectly normal. Okay, so we'll just quickly look at some common symptoms so that you know that these are things that are normal. So that when you have them, you're not scared. All right? Nausea, vomiting, mild swelling, heartburn. I don't know if you have had heartburn. Okay, yes. I don't know if you have had swelling on your legs. Not yet. That usually occurs during the third trimester. I don't know if you have experienced nausea and vomiting. Okay. I don't know if you also have experienced increased urination, peeing frequently. Okay. So you see, these are all common symptoms that pregnant women will have. Okay. So when you have them, don't panic, nothing to worry about. They're common. For if you're having nausea, vomiting, that is normal. But if it becomes so severe that you cannot tolerate any food, then that's what we call hyperemesis gravidarum. For that, you have to be admitted in the hospital. We need to break that circle. Because if you're not able to tolerate anything orally, and you don't break it, very soon you begin to have contractions because you become severely dehydrated. The levels of oxytocin in your body will rise, and that oxytocin is what causes your uterus to cramp. And before you know what's happening, bleeding will start. Of course, you'll be so weak because you're not able to eat anything. So what we do, once you get to that level, we need to admit you, give you medications parenterally. That means either IV or IM, not by mouth. Anything you take by mouth will come out. We give you, and then we rehydrate you. Once we rehydrate you, and we give you injections to stop the vomiting, and you cannot take orally, and you cannot go. and they will give you medications for you to take to prevent the vomiting. Like I said before, it may continue for most patients until after the first trimester. Of course, for those who are carrying more than one, the effect will be more. Okay? Of course, mild swelling, that is normal. That you begin to experience usually from late second into the third trimester. So when you experience that, that is not a challenge. We call it edema, particularly of your legs. Some people too, it can be much, depending on the number of babies that they are carrying, or if they have developed what we call hypertensive disorders in pregnancy. All right, so those, of course, you check your blood pressure and ensure that everything is okay. Heartburn, common. So once you're having heartburn, you tell your doctor, he will prescribe for you antacids. If antacids are not working, then we can prescribe omeprazole. Those are medications that help to reduce the acidity in your stomach. Then of course, back pain, if it's too much, you can take paracetamol. All right? Back pain is different from abdominal pain. Back pain usually occurs late in pregnancy due to pressure, due to the weight that you are carrying. All right? And is different from abdominal pain. In fact, sometimes you can have both back pain and abdominal pain. Now, once you are having that and you are late in the trimester, we need to be sure that you're not having contraction. All right? And then we've already explained increased urination. So we've talked about the emotional changes, mood swings, which are normal, anxiety about the baby. A lot of men, which is normal, they can fear. That's the word to use. They can be so anxious about how's my baby? Hey, this one, check my baby. Is everything fine? Most times everything is fine. That's why I believe that the highlight of a pregnant woman's visit to the hospital for antenatal care is when they hear that baby's heart beating. Let's know that everything is okay. Which is normal because you want to be sure that everything is okay with your baby. All right? And then you must also ensure that you have all the necessary support. To the men, I know I don't have anyone here now, but I know there are men who may be listening to me. Please make sure you support your wives during pregnancy. Pregnancy is not easy. If men were to carry pregnancy, I can assure you they can only carry one, and that will be all. They are okay. So women that carry one, carry two, carry three, carry four, and they stop carrying for some time, they are coming back to the doctor. How far? How far with what? I want a fifth one. Sit to Abba. These women need to be praised. So please, men, please support your wives. Support them. Pet them. Provide for them. Because what the hormones do to a woman is not a joke when she's pregnant. So she needs all the support that she can get. All the support. So please, let's ensure that we provide them with the necessary support. It's because of the lack of that support. That's why a woman would deliver and go into psychosis. Baby she carried for 9 months, she doesn't want to see the baby. In fact, she can even harm the baby. Why? Because there was no support. No support. So support is very, very important. So very importantly, when should a woman be consigned? When to be consigned? You are pregnant. What should happen that should make you be concerned? So number one, severe abdominal pains. Once you're having severe abdominal pains, you should raise an alarm. You should come to the hospital. Why? Because severe abdominal pain is not normal, and depending on what stage of pregnancy it is occurring, can mean different things. If it's occurring in the first trimester, it could mean that you're having miscarriage, particularly if it is followed or accompanied by bleeding. If it's occurring in the second trimester, it could also mean that if it's early in the second trimester, it could also mean that you're trying to have a premature delivery. All right? If it's occurring in the third trimester, the same thing, premature delivery. All right? So once you're having abdominal pain, and there are many things that can cause abdominal pains. So the earlier you come to the hospital, the better. Fever can cause abdominal pain. Dehydration, not taking enough fluid, can cause abdominal pain. You understand? Urinary tract infection can cause abdominal pain. All right? So once you are having abdominal pain, you must come to the hospital. What else should you be concerned about? Heavy bleeding. Heavy bleeding. Once you start, if it's spots, dark brown, nothing to worry about. But once you begin to, because a woman that is pregnant should not bleed. That is normal. Once you are pregnant, bleeding stops. Normal menstrual period stops for 9 months. Because why? Where the bleeding should come out from, baby has taken over. Baby has occupancy for 9 months. So normal menstrual flow should not happen. But if you are pregnant and you start bleeding, again, depending on the trimester, it could mean an issue. If it's the first trimester, it means what? Miscarriage. Now, depending on the severity of the bleeding and what stage it is, it could just be a threatened miscarriage. The baby is still alive, baby is still there, but they're just bleeding. And it also depends on the cause. You come to the hospital, the bleeding can be stopped. Also depends on if that bleeding is accompanied by abdominal pains. If it's just only bleeding you're having and there's no pain, it can be, the prognosis is better than if you have abdominal pain and bleeding. All right? If it is the second trimester, third trimester, and you are bleeding, and there's no pain, it means that the placenta is low lying, or the placenta is trying to separate from the uterus. And those two scenarios are not good. All right? And so once there's heavy bleeding, you must come to the hospital. All right? Then persistent vomiting. We've talked about this hyperemesis gravidarum. So once you're having that, you must come to the hospital, or maybe it could be due to other causes. Then high fever. All right? You have very high fever, and there's severe headache. If you're having severe headache, you must come to the hospital. You have taken paracetamol, it's not going. It could just be that your blood pressure is very high. And that could mean that you are probably getting into preeclampsia and possibly eclampsia. That's the reason why some women, while they are pregnant, they can fit, they can have convulsion. If you find that, they'll tell you that, for some days I was having severe headache that could not go. It was not due to malaria, because I didn't have fever, nothing, just this constant headache. Only for them to check blood pressure and see that blood pressure was very high. All right? That's the reason why when you come for your antenatal care, part of what we do, we insist that you must do your blood pressure. If you come to this hospital 3 times in a week, as long as you are pregnant, you must enter that vital signs room. You don't say, "Oh, MD, I just came to come and greet your face." Do vital signs, then you come and greet me. No problem. All right? Why? Because from that vital signs we do, it shows us a lot of things. Your blood pressure, your pulse, the urinalysis, your weight, all of those things that we do, they all interpret. In fact, those things are even more important than the scan. Because we know your baby is fine. But is the person carrying the baby fine? It is those vital signs that we do that helps us to tell if the carrier of the baby is doing well. All right? So when these things happen, please be consigned and then you come to the hospital. That is why it is very important that we pay attention to our antenatal care. And once a woman is pregnant, the fact that 80 to 85% of women will even deliver without any care at all. After all, women in the villages, which care do they receive? Some women even deliver in the farm, clean up, cut the thing, clean themselves, pull everything out, carry baby home. But you see, that 15% that will need care is the reason why we do antenatal care. Because those 15% don't get that care, then disaster will happen. All right? So we do antenatal care to monitor mother's health. All right, next slide. To monitor baby's growth, to detect problems early, and then to provide guidance and support. That's how we do antenatal care. So don't say, oh, I have a patient who has delivered before, and in this current pregnancy, just say, doctor, I just came with, I don't think I need antenatal care. I can even teach women now who are getting pregnant. We have done these things before. I say, it's not like that. Every pregnancy is different. The fact that you have delivered 4 children does not mean that the fifth one will come. You don't say, I won't see any doctor. It's a lie. Why? Because every pregnancy is different. So you need to be cared for during your pregnancy, both you and the baby. And then you detect problems early, and then the necessary guidance and support are given. That's why we do what we're doing in these classes, because I believe that knowledge is power. Once you are empowered with knowledge and you are involved in the care during your pregnancy, it will help. So what happens during our antenatal visits is important you know this, so that when you come for antenatal, it's not just to come and just be greeting the nurses and greet the doctor, and then, check my baby heartbeat, bang, 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 finish, I've done antenatal. No, what actually happens during antenatal. So the vital checks that are done are very, very important. For me, they are the most important. So you see what happens in that nursing station is more important than what happens in the doctor's office. Mrs. Susan, so how are you? I'm fine. How's everything? Everything's okay. Any complaints? No complaint. Okay, lie down. Let's check your baby. You lie down. This is how this is seen. Oh, very good. How many weeks is the baby? You already know how many weeks the baby is. You have to confirm. Oh, baby is okay. Baby is doing well. Okay now. But if you don't do those vital signs and your blood pressure is hitting the roof, you will not know. God forbid you go home the next time they will say this woman convulsed. If your protein is 3+, you will not know if you don't do the analysis. Or if your blood sugar is 3+, you will not know. This woman that has normal sugar level, because she's not pregnant, she has developed diabetes. You will not know. All right? Huh? You understand? That is why we do all of those things. Oh, you have urinary tract infection. You will not know if you don't do it, because from that urine you do, if there's nitrite, it will tell us that this woman is likely to have infection. Or we see leukocytes. And then we check your pulse. This woman's pulse is very high. What is happening? It's not on salbutamol. Is it possible that her blood level is low? So her heart is working over time. Oh, check. She's safe. Go and do test. So you can see all the things that we can get. We check her weight. The weight is checking 3 times consecutively. The same thing. First, she has even dropped weight. Madam, are you eating? I say, actually, I'm not eating well. You will know. Even from the urine, we see ketones. Just say, madam, you'll not be eating well. It's true. How did you know, doctor? From your urine. Why? Because your body is breaking down the salt part. Your baby is a parasite. Baby must feed whether you eat or you don't eat. You're the one that will suffer. You already have seen that your body is breaking down what it has stored before. That means you're not eating enough for you and the baby. So that test is very important, and it shows us a lot of things. So you check your weight, you check your blood pressure. If the blood pressure is normal, you not to say, okay, what's my blood pressure? Oh, your blood pressure is not, so it's fine. You understand? It's very reassuring. Then the lab test, then it's after that you now come to see the doctor. How are you doing? Everything is fine. You check the baby's heartbeat, and measure the baby's growth, and everything is fine. Then you pick up your medication, and then you go home. If there are other additional tests you need to do based on the complaints you are giving, then you go to the lab and do those tests, and then you pick up your medication. All right? Very, very, it's a standard rule. You come for your antenatal, you must do your vital signs check, you must do your urinalysis. Don't say, I peed before I came, so I'm not feeling pressed, so that's why I did not do it. No. Before you come, just calculate it so that you have some urine. You are feeling pressed, so that once you come and you go in, you have urine to give to them. If not, after they are seeing you, you will stay behind. Take water and be pressed and do that test before you go. Very important. All right? And then when you do your scan, we normally will check the babies. You notice that we will try to measure some parameters in the baby just to ensure that baby is growing well. So initially, in the early stages, we will use what we call the cramp rump length, CRL. Once you get to above 12 weeks, second trimester, we start using the BPD, that is to measure the baby's head. All right? Then from there, around the third trimester, close to the third trimester, we start using the femoral length. All of these measurements is to see how your baby is growing and to ensure that the growth is commensurate with the date of the pregnancy. And then from the third trimester, we also start calculating the baby's weight. So we want to know what is the weight of this baby as you are approaching delivery. Then, so what's the role as a mother? Now that you are pregnant, what is your role? Because you have a role. So your role is, number one, attend clinic regularly. That's your role. Make sure you attend clinic regularly. Take your medications. All right. All that have been your instructions you have been given, you follow them. Okay? Take your medications. Eat well. Those people say, no, I don't feel like eating. You don't feel like eating. Eat. You're not eating for yourself. You are eating for both yourself and for the baby. See, the only person that came with her water, though it's just now she's drinking it, is this my patient before me. Okay, this one came with liquid, but it is not water. You chop water. Okay. And so just collect that one, no problem. All right. Eat well. So you're not only eating for yourself, you're eating for the baby. So it's not like when I feel like eating. It's a structured, you must have a structured eating pattern. And then make sure you eat balanced diets. Carbs, protein, fats, vegetables, fruits. Okay? Very important. Although I know that it's sometimes difficult for pregnant women to be able to eat what they want to eat because it may not just flow, but you try. And then you report any unusual symptoms. Okay? So if you're feeling somehow, you're feeling anyhow, please report to your doctor. That is why here you have access to the medical team. So anything you are feeling, anytime you are feeling, please just send us a message so that we can intervene appropriately. And what is our role? What is the role of JJ Hospital? Our role is to provide you with safe care, to monitor you and your baby, all right? And to support you emotionally and to ensure that you have a safe delivery, all right? That is our commitment to you. So, as I close, what are the take home messages? One, pregnancy is a journey in stages. It's a journey of 9 months, solid. Any attempt for you to cut that journey short, you are doing yourself. It's a journey of 9 months, which is in stages. And we'll talk about the stages. There are many changes that occur during this 9 months period are normal. You go through them, and after that, you return back. It's important for us to know danger signs, things that happen that should be a cause for concern, which we have talked about. Severe abdominal pain, bleeding, headaches, and all of those. And then make sure you attend antenatal care regularly, both the classes and the clinic visit to your doctor. Right here at JJ Hospital, we do, because of the kind of patients we have, most of our patients are patients who get pregnant from our assisted reproductive technology program. We do every 2 weeks visit is what we do. That is not the normal one. The normal is every 4 weeks. But the reason why we do 2 weeks, because we treat all of them as special, as high risk. Because anyone that gets pregnant from IVF is a high risk. You have to give special attention. You can't be say come every month. So that is why we do that. So we see them every 2 weeks until they get to about 34, 35 weeks, 36. Then we now start seeing them every week. All right? And then we have our antenatal classes every month. Okay? So we have started now, and we hope to ensure that we are do it every month. The antenatal classes is essentially to just teach about the issues of associated with pregnancy, so that you can be empowered to be able to provide care. All right? Okay, so I'm done. Next, questions and answers. Questions? Any question? From our physical audience? Any question from our online audience? If you have, you can please just send it. Daniel, can they send it? They can send it, right? They can what? Comment. And you get it. Okay, so the IT team said that you should comment. I don't know what that means, but just comment, and he will receive it. All right. For those who are physically on ground, any question? Okay, anomaly scans. Okay, so the reason why I didn't mention it because it's not something we do here. All right. But I know that it's something that it can be done at 20 weeks, 18 to 20 weeks. All right. So the reason why we don't add that to our service is that most of our pregnancies are normal. So for you to now start doing one anomaly scan to look for one thing or the other. So maybe we should begin to do it. I know when we start doing it, that will now come with terms and conditions. We will apply. Ego would. Yeah. At the end of the day, everything is still normal. Yeah. So we don't do it. But if you want to do it, we can ask you to do it in town, in one of the diagnostic centers. Just to maybe just calm your mind that all is well. Yes.
Always feel hungry, like if I'm not eating throughout this week.
It is normal. It is normal. As if you have not eaten throughout this week at all.
Like,
The hunger will just come. And if you don't eat anything that time, your body will.
now,
Uh,
just 1 minute,
uh,
like
you've not eaten. Yes. It's part of the hormone. Okay, his own is better, because yours is opposite. You don't feel like eating. It's all as a result of the hormones. You must eat. Hunger. See, that's why I said the pregnant woman is a fourth being. Is something you can't understand them, and every pregnancy is different. Every pregnancy is different. So it's like that, and very soon that will stop, and another one will not come. So usually these kind of things, they don't last long. See how she's like, she eats nice as if she has not eaten. After a while, it will just go. The one that is not eating at all, after a while, appetite will just come, and she wants to eat everything. So that is it. All right. Any question? Okay. I feel pain while urinating. Yes. So one of the commonest cause of what we call dysuria, that is painful micturition, is infection. So if a woman feels pain while she's urinating, the first thing we want to do is to rule out UTI, urinary tract infection. So she has to go through tests, all right, urine test to be sure that there's no infection. If there's infection, and then you have to treat. Okay? Any other question? So have you entered the cruising phase? Have you entered the cruising phase? Are you above 13 weeks? Okay, you're not above 13. You're 13 weeks. Going to 10 weeks. Okay. It's like, some women are very blessed that even in the first trimester, everything is so normal. No pregnancy symptoms at all. So you want to wonder, seeing that she's saying that she's not feeling, as she feels as if she's not pregnant. So the question is, do you want to be feeling pregnant all the time? Because that is another issue. Because when you start feeling pregnant all the time, you say, oh my God, what is this? So your state, be happy. All right? Be happy. Be happy. It happens. All right? It happens. That's why everybody is different. Everybody is different. All right. So, another question? Okay. Okay. Thank you very much. Thank you very much. Another question? No? Okay. So, as I close, I want to thank, next slide, I want to thank all of you for coming, particularly those who came physically, all right, and then those who watched online. Please, I want to make a special appeal to our husbands. Please come. Because I don't know now if they joined online. It's the women that usually will join. But you see, you are a co-partner in this journey, in this pregnancy. You are the assistant. But what we normally say is that the husbands are the primary physicians. Because she is the one who notices what is happening. Doctor is not there. I'm not there. So when they come to visit, you will say, you forgot to tell doctor this one. No, this one, no, you told me this on the other day. And you said this and you said that. So the husband is the primary physician. So please, we want to thank you for all your support and all you do. And to say, please make sure you are part of the journey. And we hope to see more men, of course, more women coming physically. Well, I can understand why we're not having so many come physically. These days to drive around is not easy with the cost of petrol and everything. So I can understand. But please, and the weather. So, but if they join online, which I know a lot of them do, then that is good. And to say to you all that you are doing an amazing job, all right, and that we're definitely going to be with you every step of the way. And we wish you all a very smooth, uneventful antenatal period and a safe delivery. All right. Another question has come after I've done my closing. Then, okay, what is the question? That question is a very crucial question. Uh, okay, so it depends. Now, I don't know that person that's asking this question now whether she did IVF or if she has had a history of preterm miscarriages, if she has had a sacrilege. All of those things help to determine, or if she has had any issues before, any complications. All right. Usually, in a normal, uncomplicated pregnancy, that is born that you got spontaneously, not IVF, you can have sex anytime. Really, there are really no restrictions. But if you've had a complicated pregnancy before, e.g., you had bleeding during your pregnancy or you are currently bleeding, then you should not have sex. If you had, if you lost a pregnancy midway or in the first trimester or early second trimester, and they say, oh, your cervix is incompetent and they have to put a sacrilege, you should not have sex. If you got pregnant through IVF, usually we advise that in the first trimester, just to be, we really put a lot of caution simply because of how the pregnancy came. We don't want anything to jeopardize it. And if you now have sacrilege IVF, so if you now have sacrilege on top, then that weight increases. Because after sacrilege, you now wait for another 2 months. By which time you are probably like 5 weeks, 5 months. If by 5 months, 6 months, you still want to, if not, you can just say, Oga, we have come this far. What are we looking for? Just relax. Let me finish. But after 5 to 6 months, if you've had a cervical sacrilege, then you can resume having sex. Okay. Okay, I think that's all. No more questions. All right. So thank you very much. I want to appreciate all of you for coming. And then our next antenatal class will be second Saturday of next month. All right. By which time everybody would have moved forward some weeks, and you would have been closer to the day of delivery than today. All right. Have a wonderful weekend. God bless you. Okay. Okay. I'm very scarce. Okay, so I'll just see people here one by one.
Yes, ma'am.